For Friday, July 19th, I'm Glenn Halleck. ICE canola futures are higher on Friday as the November contract pushes above its resistance level of $650 per ton. That November canola contract adds $7 at $656.70 per ton, and the January contract rises $5.40 at $661.20 per ton. With a heat wave forecast for the prairies, there's a good amount of canola in the western half of the region still blooming. The extreme heat could result in pods not fully developing. Also underpinning canola this morning are gains in the Chicago soy complex, Malaysian palm oil, and European rapeseed. Modest losses in crude oil are trying to put a lid on further increases in the oilseeds. The November canola contract has moved above its 20, 50, and 100-day moving averages and is closing in on its 200-day average. Canola crush margins continue to step back, with its November position sliding to $97 to $102 per ton above the futures. The Canadian Grain Commission reports producer deliveries of canola for the week ending July 14th increased to more than 523,000 tons. Canola exports fall back to about 171,000 tons, and domestic use improves to almost 226,000 tons. The Canadian dollar is lower on Friday morning as the loonie drops to 72.83 US cents compared to Thursday's close of 73.01. The United States Department of Agriculture reports a private sale for 105,000 tons of new crop soy meal to unknown destinations. The U.S. weather outlook for the main corn and soybean areas call for normal temperatures with very little in the way of rain. China reports its June corn imports alone plummeted 50% from a year ago. So far this year, China's intake of world corn is down 8%. Rounding off prices at the Chicago Board of Trade, soybean futures are on the rise Friday morning. The November contract adds 5 cents at $10.48 per bushel. August soy oil increases by almost 3/4 of a cent at 47.18 cents per pound. August soy meal bumps up $1.70 at $338.90 per short ton. Also in Chicago, September corn is up 4 cents at $3.95.5 per bushel. September oats gain 3.5 cents at $3.34. The U.S. wheat complex is stronger as Chicago September advances 20 cents at $5.55. Kansas City September increases 16 cents at $5.78.5. And Minneapolis September climbs 17 cents at $6.17. That's a look at the ICE futures and Chicago markets for Friday morning, July 19th. For MarketsFarm.com in Winnipeg, I'm Glenn Halleck.
Outstanding capacity, innovation, and the industry's highest density come together in a New Holland roll belt round baler available from Butler Farm Equipment in Fort St. John. Whether you make 4x5 foot, 4x6 foot, or 5x6 foot bales, there's a roll belt right for you. All models feature wide, durable pickups and smooth feeding systems for faster baling. Integrated precision solutions help you make smart baling decisions on the go. Stop by Butler Farm Equipment in Fort St. John today.
The opinions expressed on this show do not represent those of the station. If you've missed any of the shows, you can follow the podcast at Energeticcity.ca. Welcome to This Week in the Peace, a show dedicated to the people, events, and news of BC's Peace region. Here's your hosts, Dub Craig and Steve Berard.
Good morning, I'm Dub Craig. Steve is off this week. On the show today, hospitals in and around Northern Health continue to put emergency rooms on diversion. Fort St. John's emergency room was on diversion for 5 days in the past week due to inadequate physician coverage. And as it turns out, the birthing center is going to be closed all weekend as well. Now, we asked Northern Health and BC's Minister of Health, Adrian Dix, for an interview. We've asked several times this week, and neither have made themselves available to us. So, to offer some commentary on the ongoing challenges in BC's healthcare system and in Northern Health, we're joined now by the Executive Director of the BC Rural Health Network, Paul Adams. Paul, welcome to the show. Thank you so much for taking some time to spend with us today.
Thank you for having me, Deb. Good to be here.
So why don't you start by telling us a bit about what the BC Rural Health Network is, first of all?
Sure. So we're a nonprofit charity. We're an apolitical, nonpartisan organization, and we represent solutions on rural healthcare We have a broad membership, pan-provincial membership from Haida Gwaii all the way to Fort Nelson, down to the East Kootenays and across to the southern tip of Vancouver Island.
And is part of your mandate sort of advocating for, I suppose, kind of people who have rural health for the challenge, like I guess, bringing light to the challenges that are unique to, the people who live in BC's rural areas?
Yeah, we really want to connect and listen and hear the voices of rural residents across the province. And we view ourselves as a communication organization, so a bidirectional communication where we're listening and hearing community voices, and we have tables and committees where we form policy positions, and we use those based on evidence coming from community and from science. And then we take policies forward to the ministry and to health authorities and look to make changes within the system.
I see. Well, I wonder if we can talk broadly, kind of about some of the biggest challenges that rural healthcare in BC faces. We'll talk more specific challenges in a moment, and especially the ones that seem to be top of mind lately. But broadly, what are we looking at here?
Well, we've been in a healthcare crisis in rural BC for decades. It is not a new situation. We always have very difficult times with recruitment and with retention. And then you throw a pandemic into the mix, and that heightens all of the problems that are at hand. And now we're looking, post those events in a situation where we have an aging demographic, and we have people who are getting older rapidly. That includes our physicians and our healthcare providers. And so we're starting to see a further pressure put on the system through people aging and retiring and moving out of the system.
Why has it been so much harder to recruit doctors, nurses, just healthcare professionals in general to come work in rural places like Fort St. John or Quesnel or, Dease Lake, or Princeton even, as an example? Why is that? Why is that such a challenge as compared to, the Lower Mainland or the South Vancouver Island?
I think it becomes, there's a variety of issues. One is the people who are interested in working in rural BC, aren't necessarily the same people who are coming out of the medical school system. So we have a lot of urban students entering, medical schools, nursing schools, and their desire is going to be to work in a community that they're comfortable with. I think the biggest challenge that we've faced is that when we went through regional centralization in the early 2000s and we created health authorities, we centralized many services. So especially in small towns, not so much in Fort St. John or in the larger centers within the north, but in smaller communities, we stripped away a lot of the elements of practice that allow people to work to their full scope. So if you're a medical doctor or if you're a nurse and you want to work in the field that you've been trained in, those opportunities may not be available for you in rural BC. And I think we over-centralized. So I think there's the ability to bring some services back into community and to provide a means to recruit and retain people because there is services which are going to allow them to work to their full scope.
Mm-hmm. I mean, we see that, like, I don't have the number in front of me. I should have, so I apologize for that. But I know Northern Health, for example, is offering pretty big incentives for people to come work for them, in Fort St. John and other Northern Health kind of areas. So it can't just be about the money, I suppose, because if it was, I mean, it seems at least, though, that this government, previous BC Liberal governments have been throwing money at the problem, as you say, for decades. But, I mean, the challenges still exist.
Yeah, so again, we have to rebuild community infrastructure. We have to have a place to recruit to. Our education system in northern and rural communities is usually not as robust as that's happening within urban centers in the southern portion of the province. We need more recreational opportunities. We need to build better facilities within rural and northern communities in order to retain people over the long term. And we need to have more rural students in seats in the medical field. So when they come out of school, they're going to be wanting to return to an environment they're comfortable with. And getting people who come from rural is a lot easier to get them back into rural than making somebody who is accustomed to an urban environment moving into an unfamiliar setting. So I think it's a variety. There's a whole range of things that need to happen. We need to improve the team-based care. We need to create safe working environments for nurses and for physicians. So it doesn't really matter how much money you pay somebody, that may attract somebody for a short duration of time. But they need to have a quality of life and both a working life and their pleasure time to equate to something that they want for themselves and for their families. So these things aren't rocket science from the standpoint of complexity, but we really haven't put much attention into that, and we tend to put out fires as they come up, and we try to do that with incentives financially, and that's certainly needed, but it's not the entire solution.
Now, I want to talk a bit about at least about an interview that Health Minister Adrian Dix gave on the CBC in Prince George the other day. He spent a lot of the interview talking about how this is not just a BC problem. It's a global problem. There's healthcare shortages, healthcare professionals shortages everywhere. And he kind of kept going back to our solution is we are aggressively, trying to recruit doctors and nurses with financial incentives, yada, yada. I mean, in my opinion, the interview was short on actual answers as to how you're going to address the problem now and kind of in the future. I wonder if you could comment a bit about this government strategy, and even if you want to, as you say, go back to previous government strategy on why, as you say, it's not working by just putting out fires. What can, if anything, this government be doing right now to help solve the problem and not just be looking kind of also to the future? Is there anything that could be being done right now to help solve the problem?
So I don't want to be critical of any individual within the system. I don't think that there's a lot of benefit in playing politics in health. And I think that we do a lot of that, unfortunately. And I think that, we should collectively come together and start rethinking the system from a 21st century point of view. And, we tend to have taken a 20th century situation, and we keep trying to make it work for our current times. And times have changed. So I think we have to recognize that we can't go back in time, revive a system from the past into today's world. So what can we do in the short term? I think that money may be part of the answer. We may need to continue to offer incentives to get people in place, and then we have to look at what it is that's causing people to leave. So, having just simple business protocols you have a physician leaving who is not at retirement age, or you have nurses not wanting to perform the job within a certain geography. We need to actually understand what the reason that is and start getting into exit interviews and understanding what it is that's motivating people to leave community. I'm on my third family doctor in 5 years. And she's leaving next month, and my kids, my grandkids, and myself will all be unattached from a primary care provider. And that primary care provider is also our emergency medical provider. So, they're one and the same in many rural BC communities. So why is she leaving? And what would have kept her here? Answering some of those questions with the lived experience of the actual physician and the nurse, and understanding what's driving them to make those decisions, I think leads us to where we need to go in making adjustments to the system. I think rural and northern BC are completely unique from the urban populations, and just our population density means that we have to spend a lot more money in order to provide equitable access to care. for our residents in the same way that urban populations get access for their residents. So we have to recognize that, and I think we should be creating a division within the Ministry of Health, which is specifically focused on rural and northern communities and remote communities, and that we have a specific focus within the bureaucracy of government that looks at those issues. And I know there's work being done because I'm working with people behind the scenes within the Ministry of Health on developing rural health strategies, and that work is critical and it takes time. And so, I think there's no magic button. There's no easy button. We can't press the button and expect things are going to change overnight. But we can make system-wide and systematic changes as we move forward, which are going to reflect the needs of communities broadly within rural BC.
Mm-hmm. Another thing that's been happening up here that's kind of drawn the ire of locals too is when it's announced that an emergency room has gone on diversion. We've kind of run the gamut from sometimes it isn't announced and we were told no one was available to write up a Facebook post was essentially the answer we were given, to it's announced an hour beforehand that Fort St. John's emergency department won't be available for 14 hours starting an hour from now. I just hope to kind of hear your commentary on even that situation and the difficulty. And I understand that we want to, up to the last minute, ensure that we've covered every base to try and cover the shift, but also kind of weighing that, and can we let people know that if something happens while this emergency room's going to be on diversion, can we let them know, with enough time that I guess alternate plans can be made if they need to be, so they don't show up at the door and find out that the emergency room is closed. I wonder if you have any kind of thoughts on that.
I do. I think it's unacceptable. I think that we can't have. We've had people die. There have been deaths that have occurred where people have showed up and there's a note on the door to say that you've been diverted to, and these aren't diversions. These are closures. The emergency room is closed, and you cannot access emergency care in this community. And that puts people's lives at risk. So I don't know the reasons why it's left to the last minute, but even if it's the last moment, I think we should have emergency response teams available that are able to come to a community and make sure that at least the front doors of the facility are left open, and that there is care provision, emergency care provision, primary care provision should not be your neighbor with a first aid kit and a vehicle. That is not an acceptable solution. We have Section 12(1)(a) of the Canada Health Act, which clearly states that every insured patient in our province has equity to access and care without any financial barrier or burden. So that needs to be, the piece that we start with, not that we end with. And that, when we're looking at how to address and make sure that everybody in the province has care, that means we have to start with the most marginalized and the people who live the furthest away, and work our way inward, and that way we capture everybody within the system. And it's a financial challenge, it's a human resource challenge, and you mentioned that it's a global problem. It is a global problem. We have a global shortage, and we're just seeing the tip of the iceberg now. We have another 25% of our physicians globally are going to retire over the next decade. We have the same situation happening with nurses. So we need to get all hands on deck. We need to get more people, more boots on the ground. And we need to look at how we can expedite situations like foreign credentials and get people into the system faster and expediently. And use resources such as physician assistants more readily, where we have the ability to extend a physician into being able to provide more services because we have support systems in play for them. And we need to, again, there's now some good incentives for nursing, where we have in Northern Health $30,000 going to a nurse student who wants to work in the North, or from somebody from an urban environment who will relocate to the North. There's a $30,000 signing bonus to stay for 2 years in practice. But how do we keep them beyond that 2-year time frame? And how do we start attaching people to a place of care rather than an individual. You know, if I walked into my medical clinic and I don't have a physician, but I did have other care providers there who understood my needs, then at least I would have somebody that I could ask questions of and get advice from and make the appropriate suggestions on where to go, and the urgency of that. We're leaving people coming to the front doors of emergency rooms with a note on the door is just, again, it's not only unacceptable, it's putting people's lives at harm, and that's the opposite of what healthcare is about.
Mm-hmm. We got about a minute left here with Paul Adams with the BC Rural Health Network. You mentioned the Canada Health Act, and I kind of want to wrap up with a final thought from you on the federal government's role to play in this. As we said, it's a national problem. The federal government provides huge health transfers for funding for healthcare to the provinces. What role do you think the federal government has to play in ameliorating this crisis in BC and in Canada?
Yeah, as a funding mechanism, they need to step up as well, and we need to ensure that we're not just looking at it as a dollar sign, and that perhaps, again, from the amount of money that we spend, I think we're at $32 billion a year on our BC budget, which is, a very significant portion of our overall operational budget for the province. So a lot of it, to me, comes down to where we're spending that money and how we're spending that money, and looking at means and ways that we can actually reduce the amount of the cost in certain areas. And it shouldn't always be about the outflow of cash. It needs to be about improving systems that make sense. And, we see how privatization on nursing, for example, has made a huge impact to the cost of that provision. We use agency nurses, and we're using them at an increased level in the north and in rural communities, where we're paying a private entity to provide the same nurse through an agency agreement, which is costing the taxpayers twice as much money as having somebody in the public system. So why are we not enhancing the amount of pay and benefits within the public system and removing agency nursing from the equation? And, there's straightforward, simple, common sense solutions that we can all come up with. And obviously the system is very complicated and there's many levels to it. So it's not just a easy situation, but the time to start making those changes is now. It has to start now.
All right, Paul, we're going to have to leave it there for today, but I'm very grateful for your time. Thanks for joining us.
Well, thank you for having me. Appreciate it. And I hope everything works out up north.
So do we. We appreciate your time. Again, that's Paul Adams with the BC Rural Health Network. We'll be right back to wrap things up on This Week in the Piece in just a moment.
Tim's Maple Bacon is back, featuring crispy, naturally smoked bacon with a sweet and savory maple glaze and a 100% Canadian fresh cracked egg, all on a new cheddar croissant. Try Tim's Maple Bacon breakfast sandwich today at participating restaurants in Canada for a limited time.
It's time for Tim's.
The skies come alive. The Grand Prairie Regional Air Show is July 27th and 28th, the largest air show in the region. Performances from the Geronimo skydiving team, Insanity Jet Car, Undaunted Air Shows, and more, plus freestyle. Motocross show, bouncy castles, face painting, and market.
Soar into savings. Stay at one of Grand Prairie's preferred DMF campgrounds or hotels and save 10% off your airshow day pass. Offer valid at the Sandman Hotel, Neil's RV Campground and Evergreen Park, Bear Paw Par 3 Golf Course and RV Park, Rotary Campground, and Country Roads RV Park. Close to the action, exceptional service and amenities. Book your airshow stay, save 10% off your tickets.
The Rotary Clubs of Grand Prairie invite you to the Grand Prairie Regional Air Show, July 27th and 28th, the first in over 15 years. More on Facebook and gpregionalairshow.com.
The Grand Prairie Regional Air Show is proudly supported by the Grand Prairie Destination Marketing Fund.
Founded over 25 years ago, Alpha Training Solutions is a full-service safety training agency offering in-class training in Fort St. John as well as on-site training across BC. Training categories include
First Aid, a Level 1 through 3 with Level 1 classes running twice a week, plus off-road vehicle training including ATV and UTV and snowmobile.
Alpha Training Solutions. See them in their new facility on 99 Avenue in the HR Block Building or register online at alpha-training.ca.
Mobile One Lube Express in Fort St. John is proud to serve this amazing community and proud to support our oil and gas industries.
See Mobile One Lube Express for oil changes, transmission fluid changes, touchless car wash, and more. Mobile One Lube Express,
a proud supporter of the oil and gas industries.
Hey, you.
Me?
Yeah, you. What are you doing? You don't belong here.
I know. I think I'm lost.
Well, there's no way out, sister. You're stuck in here with trash like us now.
Don't throw your recyclables where they don't belong. Bring them to FSJ Return It. Cans, plastic bottles, milk jugs, juice cartons, none of them belong in the trash. Recycle them today at FSJ Return It. Open 6 days a week on 93rd Avenue in Fort St. John.
When it comes to iPhones, most people think you can't replace a battery, but Micro Consulting can. If you need a new battery, see the crew at Micro Consulting because battery life is important. It's how you stay connected, take care of business, and keep in touch with the ladies. See? They just don't stop calling. Hello there. Oh, hi Mom. Also, remember to update your contacts.
For new batteries, screen replacements, parts and more, see Micro Consulting Sales and Service, keeping you connected on 100th Street and on Facebook.
Moose Country weather.
We have 2 weather alerts right now. First one being a heat warning because you're going to see some elevated temperatures throughout the weekend, and a special air quality statement because we are going to see some local smoke, which is present right now. It's going to be here for most of the day. Today, you can expect a high of 30 degrees, a chance of some showers, and a risk of thunderstorms. Later tonight, that chance of showers, risk of thunderstorms continues, but tomorrow looks like high of 31, mainly sunny skies. Sunday looks like the sun's going to be out all day with a high of 34 degrees.
You can watch this show live on Facebook. Catch the replays at Energeticcity.ca or be part of the show by texting your thoughts to the Fort City Chrysler line at 250-787-2222.
My thanks to our guest today, Paul Adams from the BC Rural Health Network. You can listen to this show again by checking out the podcast at energeticcity.ca/podcast. There's this episode, or going to be this episode, and future episodes there as well. And while you're there looking for some podcast listening pleasure, check out Before the Peace and Secrets of the North as well. We'll be off next week, so we'll be back with a brand new episode coming up on August 2nd. I'm Dub Craig. Thank you so much for watching and listening, and be well.
Join us again next Friday morning at 10 for another edition of This Week in the Peace, your weekly talk show dedicated to the people, events, and news of BC's Peace region. Or you can listen to this podcast again at Energeticcity.ca.